Well, hello and welcome everybody to this fantastic Facebook Live event by Modality Partnership. Welcome if you are listening live on Facebook, or if you're watching it back on catch up or on YouTube. It's great to have you with us. So the topic that we're talking about today is staying well in winter, which hopefully is a nice positive topic. And we hope that there'll be lots of little nuggets and tidbits. Hopefully there'll be things that we all can learn and take away to help us stay well this winter. And we've got a fantastic team of people who are talking about this topic today. So I'll go first and introduce myself. My name's Nick Bird, and I'm a GP in Haworth, in West Yorkshire, just north of Bradford. And should we go around the virtual room? Catherine, who are you and where do you come from?
Hello, thank you. Hi, everybody, and welcome to this evening. My name is Catherine Howe. I'm a GP in Keighley in West Yorkshire, not so far from where Nick works. Have we gone to Dilsha?
Hello, hi, good evening, everyone. Dilsher Singh. I am a GP here in Birmingham, in Midlands. So you all must pass through us when you go to London or coming back from London.
And then
I'm pass it over to Josh.
Yeah, so my name's Josh.
Josh?
I'm one of the practice pharmacists that working in AWC Modality. So I work across a few different sites with Nick and Catherine as well, doing sort of more pharmacist-based stuff in the surgeries rather than the GP stuff. But I'll explain a little bit more about how we can help as well later on in the talk as well.
Brilliant. Thank you, Josh. And it's really great to have Josh with us. I think demonstrating that these days general practice is not just doctors and nurses, but actually we have a whole range of different professionals with all kinds of skill sets who can help people with different health problems and help people to stay well. It's really tremendous to have Josh with us. And I just wanted to take a minute just to talk a little bit about Modality, because people can often misunderstand who we are. A Modality partnership is just that. It's a partnership of GP practices across the country. We think that we are stronger and better together, and certainly over the last 6 years that I've been a partner in Modality, I've seen we've had such benefits from working together, particularly through COVID and sharing best practice. But I think this is another example where colleagues from all around the country from the Modality family can really work together and offer different advice and support. So to kick us off thinking about staying well in winter, sometimes people can think, oh gosh, winter's a time, it's the cold and flu season, and you'll hear about NHS waiting lists and backups in hospital from crowded A&E departments. But winter can be a fantastic time, and we thought we'd kick off by sharing something that we all enjoy about winter. Catherine, do you want to go first? What do you enjoy about winter?
Yeah, so we'll be talking a little bit about some of the dangers of winter weather later in the talk. But one of my favourite things about winter are those blue sky days in the middle of winter when the sun breaks through and you feel that warmth on your skin. I love that winter sun. Thank you. Dilsha, do you want to go next about what you love about winter?
Well, thanks, Catherine.
So those cold.
So for me, the winter is a couple of things, really. One, the start for me is the Festival of Lights, the Diwali, where we all get together, get to, spend time together with friends and family and eat lots of exciting food. But the other thing I love about is the lead up to Christmas as well. The environment in the air and everywhere, just there is upbeat. And overall, I feel this is a time where you can wind down over festive season to just spend that special time with your near and dears.
Yeah, I completely agree. I completely agree with both of you so far. I think it is one of those things where I absolutely love the cold weather. As a warm-bodied person, I much prefer being in the cold. But also, I do also completely agree with you, Dilsha, in the sense that everyone just seems to be in a much better mood, especially in those last week or so before Christmas. And it falls so nicely this year with the bank holidays and the weekends.
Yeah, love
I'm really
it.
looking forward to it already. Having a nice 4-day weekend with bank holidays off and things like that. So I'm already looking forward to it.
Nick, you've not told us what
Fantastic,
your
Josh.
favourite
Yeah,
part
I
about
think for
winter is.
me, Christmas is a sorry, Catherine. It's feeling a bit laggy my end. Can you hear me okay?
Yeah, has got a little bit of time delay though. I was just saying that we've not heard about what your favourite parts of winter are.
Thank you. Well, I'd agree with everything that you've all said, but I think one of the most magical parts of the festivities of Christmas for me is heartily singing carols with other people and the music around Christmas. So fantastic. Well, I'm not sure I'll speak too much if I'm quite laggy. I'll pass you on to the wonderful Catherine Howe. Would you like to take us away about how we can stay well in winter?
Thank you. So when we've all heard the topic of tonight's conversation, and I imagine that it's meant different things to different people when they've heard what we were going to talk about this evening. And for me, when I thought about staying well in winter, what the immediate thoughts were is really about emotional well-being and mental health, because we know for a lot of people, many people, if not most people, will struggle through the winter months as the nights draw in. So we are going to hopefully talk about a little bit about emotional well-being, because on our panel this evening, everybody is really passionate about this. But we're going to start off thinking a little bit more about the physical aspects of staying well in winter. If you have a look at the slide there, we've all become experts in these things over the last couple of years. COVID-19 taught us an awful lot about how we can reduce the risk from viral infection, because there is one thing to be sure: viruses, bugs, absolutely love the winter months. There is nothing that they love more than us bringing socializing indoors, spending time with our loved ones inside, huddling close, because that is indeed how they spread. They spread directly by us talking to one another, coughing and sneezing, but also indirectly by us passing on those germs, usually from hands onto surfaces, things like door handles, taps, kitchen surfaces. But there are some basics that we can do to reduce our risk of spreading these bugs around to our loved ones, especially, and to others. And I'm not wanting to teach anybody to suck eggs here, but let's recap some of those basics. So, firstly, hand washing, one of the simplest things that we can do to reduce the spread of infection. So bugs can live on those surfaces that I mentioned before, and all surfaces, for up to 24 hours. Wash your hands thoroughly and frequently using warm water and soap. Sometimes it's helpful to have a trigger for these things to become routine if the routine has dropped in recent times. And I use the trigger of coming in from home, coming into the house, or coming into work. And then when I'm at home, I also use the trigger of meal times. We wash our hands before meals. And remembering to take a little bit longer than you would necessarily automatically do, and to try to spend about 20 seconds washing your hands. I think we'll all probably remember happy birthday twice, rather than counting. And cleaning surfaces regularly, those that have got a high footfall through our homes, people touch those surfaces regularly. And wherever possible, sneeze or cough into a tissue, bin it, or indeed into your elbow rather than into your hand, to avoid passing those germs onto others through hand contact. if you haven't already, and if you are eligible, please do have your COVID and your flu booster vaccinations. These are some of the most powerful tools in our toolkit to avoid becoming more poorly through the winter months. They are free to those who are most vulnerable and can reduce your chances of catching flu and COVID. But also, if you were to catch those infections, it really reduces the risk of significant infection. And they, by giving you the vaccination, also reduces your risk of transmitting it to more vulnerable people in your communities and also in your family too. We're going to talk a little bit about keeping warm, because it is important to keep warm in the winter. It reduces all sorts of risks, even high blood pressure and stroke risks. But what I wanted to say about, thinking about COVID-19 and coming inside, if you are well enough and fit enough and you can take your socializing outdoors on those beautiful blue sky days that I hope that we're all in store for, then that again reduces your risk of picking up infections and of indeed spreading them too. Keeping the space that you are socializing in ventilated will also reduce the risk of transmitting infections. We've put down there about checking your medicine cabinet. Josh mentioned about the bank holidays over Christmas. These are significant amounts of times where getting your medicines is not going to be as easy as it is normally. Please do make sure that you're stocked up with your routine prescriptions for the bank holiday holidays. And also for if we're predicted cold weather snaps, make sure that you've got simple remedies in the home. Paracetamol and ibuprofen are not things that you want to be going out for on icy days. And it's useful to have them ready to relieve the symptoms of colds, sore throats, coughs, and earaches. That sense of community, I think, is really important in the winter. I know many of our communities have had a very difficult couple of years. And through the winter months, it is harder to look out for one another. And it's something that it might be just worthwhile reflecting on that and thinking a bit more actively about it through the winter months. Maybe think about who lives on your road or your street, about older neighbours or older friends and family members, because they might need a bit of extra help over the winter. And there's lots of practical things that you may be able to do if you're more able. Reach out, ask them what they're worried about over the winter months. Is it the paths, for example? Is it maybe getting out for that food shop that they're needing? Is it them getting their medicines in for if they become unwell? But those are all things that it's maybe worthwhile asking the question for. And like I said, be prepared and making sure that you've got your prescription medicines before your pharmacy or the GP practice closes for Christmas. Thank you. Next slide, please.
Well, one question we actually got, Catherine, was from
yes.
Eileen Heron. She just asked specifically about, she gets quite cold hands and feet during the winter. And I was just thinking about that while you were talking, and obviously just mentioned earlier about keeping warm. There's a lot of things you can, obviously gloves and socks are the obvious answers, but there are a lot of sort of reusable hand warmers that could be really useful if you notoriously get cold hands, which you don't necessarily only have to use in your hands. If you happen to be wearing your slippers, you can obviously put them inside your slippers too. And usually they're ones that you can boil in the pan to then sort of put in boiling water to then reset so that you can use them over and over again. But yes, moving on to the next slide. Just hope that answers your question, Eileen.
Josh, before I was just going to say as well about the COVID-19 and the flu vaccinations is, if the only other one to think about is if you were over the age of 65, is your pneumococcal vaccination. It's usually a one-off vaccination, but it will reduce massively your chance of getting pneumococcal pneumonia over the winter months. So really do consider thinking about having that if you haven't already.
And in addition to what Catherine is saying, very important to understand, although we love our medical jargon about pneumococcus, but what I like to say is in plain words that actually this is a bug that can cause nasty chest infections, which can result in actually quite serious complications, including death. So that's why we're all very keen that you get that vaccination and protect yourself from this nasty bug.
Thank you.
And there was just one more question from Bill Graham. I've got asthma and can get wheezy in the winter. What can I do to make my breathing easier? My sort of going off of what Catherine was saying about being prepared and making sure your medicine cabinet's full, just making sure that you have a blue inhaler that's in date, because it's quite common when people who potentially have their asthma quite well managed for the rest of the year with a cold snap might then need to use their blue inhalers a little bit more often. So just make sure you've always got one in. And obviously, if you find yourself using your blue inhaler more often for a significant period of time, then getting in contact for a review with the respiratory nurses or the GPs to discuss stepping up your treatment is always a good answer as well. And also just trying to be very conscious that you might get wheezy and make sure you have your blue inhaler wherever you go. All right. So
and in addition to that, Josh, I think if some of our patients may also be on inhalers like Foster or others, where on the SMART regime. So during winter months, in liaison with your practices, with your nurses at the practices, and in your asthma reviews, get your asthma reviews sorted before, if you know you're going to start getting this in winter, so you are prepared with a plan with your practice nurse to or your GP to make sure you know what to do. Or do you need to push up the blue, or do you need to push up your purple one that you already have? And again, if you know you're going to get that planning for before you actually hit that snag.
Perfect. So I think we'll move on. I can see there's a few more questions coming in, but we'll move on to the next slide and then we'll come back to the questions at the end, if that's all right. There you go, Catherine.
Thank you. So we thought it would be helpful to talk about some of the self-care that we can all do if we catch one of these winter illnesses. So commonly when we think of winter illnesses, we think of viral respiratory tract infections. Sometimes medical people call them URTIs, which is upper respiratory tract infections, because commonly these infections causes symptoms everywhere between our nose, our ears, sore throats, and chesty coughs too. And viral infections are commonly self-limiting. That means that they will get better themselves, and they often present with snotty noses and sneezing. So I wanted to talk a little bit about what you can do if you catch the common cold. So it's important that you rest. We talk to people all the time that are trying to do all their normal activities of daily living, all their normal activities, running around Christmas time too, when actually they just need to slow down and take it easy. They're fighting off an infection. Eating healthily is important, but it's quite common for you to feel a bit sicky whilst you have got a cold and you've got a virus. Sometimes you don't really feel like eating either. Keep things simple as best possible. And the mainstay of getting better, the most important thing is lots of fluids. Paracetamol and ibuprofen can help with some of the symptoms of a cold. They will generally take the edge off how grim you are feeling, and they will take the edge off any temperature and any pain symptoms too. And your local community pharmacy team can also help with symptom relief advice as well, and it's important not to forget them as your first port of call when you have got a common cold. I thought it would be important at this point to have a little chat about how long it would last and what common symptoms are. So quite often, a viral infection will start with clear mucus from the nose. It will then quite quickly turn into often yellow, greenish stuff, thicker nose secretions and discharge from your nose, and then commonly causes sore throats. And at this point, it gets quite difficult to sleep, often when you're feeling very stuffy. And little children can really struggle with that in particular. Then starts the cough, and it's usually the upper parts of the chest that are involved. Now, most of the symptoms will improve over a couple of days, but the cough can last for many weeks, and that's partly because the infection will be resolving, but whilst your body is fighting off this infection, there is also inflammation made around the airways, and this is entirely normal, but it will take several weeks for that inflammation to resolve. So we can expect coughs to linger for 2 to 3 weeks without any concern. And just because there's green stuff coming out of your nose, even green stuff coming off your chest, doesn't mean that you need antibiotics for that. It's just your body fighting off the infection. And in fact, antibiotics don't help at all for viruses, unfortunately. It would be very helpful to us if they did, but it's sadly not a part of the management that we can use. It's simply supportive care. So we put down there as a top tip for stuffy noses for small kids, because saline nose drops are available from over the counter and can relieve some of that stuffiness for small children when their airways are so small in their noses and it's very difficult for them to blow it out. The other thing to know about this is commonly the secretions, that dischargey stuff from their nose, will go back down the back of their throats. It can also give them a bit of a sore tummy and poorly tummy, so they may well get a bit of diarrhea at this time too. Commonly in adults, we frequently talk with adults that also will cough up and swallow what they are coughing up. Our advice is cough it out, get it down the sink, get it into a tissue and flush it, because it will make your tummy loose if you are continuing to swallow the infection that's coming up off your chest. Sore throats, what can you do about it? Plenty of fluids again. Relieve it with simple pain relief. So cool, soft food might help. Sometimes cool things help, sometimes warm things help. So we've got down there either or. See which way fits for you and your sore throat at the time. Sucking lozenges, ice cubes, ice lollies, especially for younger children. Ice lollies are a favorite in our house when the little ones have got a viral infection. Also, our tip would also be having jellies as well for children, because that's a great way of getting fluids into them when they've got a sore throat. Yogurts too. So simple things, easy to swallow. Gargling with warm salty water may also reduce swelling and pain of a sore throat. Having had tonsillitis myself and didn't use antibiotics for it because I had the same nose symptoms, the snottiness, and I knew that it was part of this viral infection, but the back of my throat was absolutely covered in pus. It was disgusting. My heart goes out to anybody who gets tonsillitis. My joyful time of that was Christmas last year. I really feel for you. It was really grim, but it did actually get better quite quickly. So how long will sore throats last? They usually get better within 3 to 7 days. I think mine lasted about 4 or 5. Often without the need of treatment by a health professional if you stick with your simple pain relief and plenty of fluids. We know something like 98% of sore throats are caused by viral infections, and it's rare for them to need antibiotics. Most sore throats last an average of 7 days, and it would be a maximum of a couple of weeks, but vast majority, especially fit and healthy people, will get rid of a sore throat much quicker than that.
Moving on to the next slide.
Thank you. I'm going to have a little chat about coughing next. Now, we talk, especially with parents, a lot about coughing, and also people that have got a prolonged cough that's going on for a long time. So I think it's worthwhile noticing at this point is how frequently we can expect different aged people to get infections, because I think there's a lot of worry out there about how frequently people become poorly and whether it's their immune system. So what I can tell you is that young children under the age of 5 who haven't come across many bugs in their lifetime yet can expect to have up to 12 or more viral infections every year. And the vast majority of those infections are through the winter months. So if there's any parents of young children out there and you just feel like your perma-snot situation and it's just rolling from one cold into another, this is often entirely normal. And our hearts go out to you, because it can be really hard to manage that, especially when you've got broken night's sleep and stuffy noses and coughs, and you can't really do anything to help other than this self-care advice that we're giving you. For older children, you'd expect them to have 5 to 6 of these viral infections each year on average. Some may have more, some will have less. But what I'm trying to say is we can all expect children certainly to have many a year, and even adults would be looking at probably on average about 3 viral infections each year, all lasting several weeks at a time. And like I mentioned about the cough, is that we can expect a cough to last 3 often 4 weeks. But at that point, if it still hasn't gone, we would want to be speaking with you. We would want you to be contacting us. As medical professionals, we often hear our patients talking about coughs because it's frustrating, isn't it? It's unsociable at the moment. Coughing in a social environment is one of the worst things that we can do. It affects our sleep and we're exhausted by it. It's tiring. Coughing all the time is really tiring. But from a medical point of view, what we get more concerned about is actually breathlessness. So it's how that infection is affecting your breathing as much as what the cough is doing. The breathlessness is our priority, although the cough is annoying. We've all been there. So what should you do? Again, rest, drink plenty of fluids. Try to stay home if you have a high temperature or if you don't feel well enough to do your normal activities. I'd also say if you're poorly and you've got vulnerable people around you, I would avoid seeing them if you can possibly do so for 10 days to avoid spreading it. You can try paracetamol and ibuprofen to treat pain. Hot lemon and honey can also be soothing for coughs and sore throats too. And again, think about your local community pharmacist for advice. We've got down there about the cough usually clearing on its own within 3 to 4 weeks. Otherwise, please do contact us. And then we talked about a little bit there about flu and COVID. So flu can be a really awful infection, as can COVID. These can be really heavy infections. Again, rest, sleep, keep warm. Paracetamol and ibuprofen to treat your temperature and treat aches and pains, because the trademark really of flu and COVID are the aches and pains, extreme tiredness, the fever and the chills. The symptoms come on very quickly, and that's the main difference between flu and COVID and a normal cough viral infection, is how quickly those symptoms do affect you. And most people end up in bed for a few days, if not longer. Healthy people usually recover in 2 to 7 days, but the tiredness may last far longer. So yes, you even talked there about the color of your pee, but drink plenty of water. And if you know the one time in my life where I think I had flu, I literally couldn't think about getting to the toilet. I wasn't sure how I was going to get there. I think I ended up on hands and knees. It can be a terrible infection. And if you're really that poorly, get water by your bed. Make sure it's a plenty big enough container to last for a significant amount of time until somebody can come top you up. Keep it by your bedside. Plenty of fluids. Drink lots, I think would be the take-home message there. I think Dilsha is going to talk to you a little bit now about symptoms that cause more concern. Thank you, Dilsha.
Thanks, Catherine, for empowering us with all these tips. So it's very important, everyone who's listening now, that despite all these excellent tips that Catherine has shared with you of your self-care, if you are still struggling and you need to recognize the symptoms where you need to seek help. Okay, so we are very lucky in NHS that actually we can seek help from various sources. We have 111, we have GP surgeries, A&Es, urgent care centers, pharmacies, which we'll go through in more detail. Josh will go through in the next slide. But it's very important for us to understand and appreciate what symptoms we have and what help we need and where to seek that. And let's just try and understand that in a bit more detail over the next 5 minutes. So if despite your self-care, despite trying all the measures that Catherine has suggested, you're still noticing that you or your child is spiking fever despite paracetamol and ibuprofen, and it is still not coming down despite use of them, then please seek advice from your GP surgery. Now, the difference of seeking advice is we need to decide when do we seek advice from surgery, when do we seek advice from 111, and when do we seek advice from urgent care center, and when from a pharmacy, from your local A&E. So let's get the first thing right. If you or your child has symptoms but is stable, then at the first instance, I would suggest the GP surgeries to reach out to them at the first instance, because we know we know you and your patients well. Sorry, I'm using the word patient, but we know your families well, and therefore it's very easy for us to help understand where you are from your norm. Especially those of you who have chronic health conditions, it's much easier when you are at your own practice for us to appreciate when the symptoms are changing for us to seek further serious help. The other thing to notice is, like Catherine said, during these periods of illnesses, and we are going to expect a lot of cough and colds over winter, if we are struggling to keep anything down and we are not able to keep water, especially fluids, that's what we worry about more than the food around this time, is that we need to keep ourselves hydrated. And the reason we do keep ourselves hydrated is so that we don't go into a situation where our kidneys pack up, and that can make things worse for us. Therefore, drinking plenty of fluids is important. But if you're struggling to drink any fluids, or you're struggling to pass any urine, and this has gone on despite your best efforts, and this starts to get from 8 to 12 hours, that's when that's your I would say that's a red light at that point, and therefore we need to get to a place of safety by getting assessed either at an urgent care center or at the nearest A&E. It's also important to understand when you have tried all these self-care and you feel, or your child is starting to get drowsy despite medications, starting to feel faint, starting to lose consciousness. And the most important thing we talk about with fevers is certain rashes. Now, some of these viral rashes are possible, but when you apply pressure on them, they blanch. If they do not blanch or do not go away, then you should seek help, and that needs to be sought pretty quickly. The other thing to notice is everything goes in our human body hand in hand. So if you're starting to struggle to keep anything in, especially the fluids, we're starting to become dry, we're not going to pass urine, we'll also start to notice that our hands and feet start to become pale. The skin starts to change, especially the palms of the hands and the sole, especially to watch out for. The other thing would be lips and tongue and gums. You'll start to notice a change in color, gray color or bluish tinge. And then again, if you or your child is starting to develop it, that is not a time to wait for this practice. That is a time to call and seek urgent help through 999. Yes, there'll be occasions where you're not sure. Now, we know barn door urgent conditions where you need to seek help, you go straight to any. Other conditions, you go to GP surgery. You can also reach out to GP surgery because nowadays we also have, as per NHS England, on the day urgent appointments. So obviously, when GPs surgeries will not turn you away for urgent criteria, especially under 5 children. If you are still unsure, then please feel free to reach out to 111, who will then direct you to the nearest urgent treatment center or back to your GP surgery based on your triage with them. The other thing to bear in mind is when to seek help with pharmacies. And now within NHS, we are empowering more and more of our colleagues to be able to help and guide you in your journey towards betterment when you are ill. So for pharmacies, there are specific criteria now that we need to watch out for. And Josh, can you take us through those in the next set of slides?
Yeah, of course I can. We are aware that there are obviously questions coming in, but we were planning on going through our slides first just to make sure that we go through all the information, and then we'll go through the questions in case they haven't been answered
Absolutely.
by the slides. So we will obviously mention the questions once we get round to them. So that sort of leads us on to this new service that has been around for a while, actually, called the Community Pharmacy Consultation Service, or CPCS for short. Now, this sort of links into what Dilsha was just saying about how community pharmacies can sometimes actually be the best place to get support for conditions that are more common. As you can see on this page, there's an awful lot of different listed conditions. To name just a few, it's things like sticky conjunctivitis and eyes, and sort of eye infections. It's your cold flu, as Catherine was mentioning earlier, when you have a bit of a sore throat, getting support with like painkillers. But there's also some very interesting things on there as well that you potentially wouldn't have thought of. Things like hair loss, or potentially getting athlete's foot, or potentially bites and things like that. There's a lot of support that the community pharmacy can actually support us with. And one of the aims of this service is to try and help GPs to allow for the most contact as possible with patients. And one of the things that they can do is they can send a notification, and it's not only GPs, it can also be NHS 111. They can send a notification directly to a community pharmacy of your choosing, asking them to sort of do an urgent consultation with you to sort of review your medications. Now, that's if you get referred through the service, but obviously this advice at most community pharmacies is completely free to get at any time that they're open. It's a walk-in service that you can just walk in and you can ask any questions that you need to, and you'll get support from somebody there on that day. It's a really good point of call to sort of mention that and sort of get that advice before potentially even contacting the GP in certain situations. I know that there's been an announcement recently about the sort of transitions of the roles in community pharmacy and what that job's going to be, and there's a real push to potentially become sort of the front door to the NHS, in the sense that the first people you potentially would go to before you'd even come to the GPs is potentially going to the community pharmacy, and then they would advise you, seeing as with their knowledge and their sort of question, their sort of understanding and asking you and getting the information off you, where the best place to go to next is, whether that is 999, A&E, GP, or anything like that. So obviously you can see the long list of things on here, and the pharmacies are also very good at mentioning and sort of ruling out those red flag symptoms that Dilsha was just mentioning. They know all the things to look out for. They know when you need better support. And it's really important to note that if you ever get a CPCS referral to a community pharmacy, that doesn't mean that we are putting you to the back of the queue and getting rid of you from the GP surgery. What that basically is saying is you can get quicker help here at the community pharmacy. If you happen to go to the pharmacy and then don't get what you need from the pharmacy and they don't feel they can help you, you then jump back into the front of the queue when they then pass you back to us at the surgery, and we will make sure that within the 24 hours that we receive that back, you'll be reviewed by a GP if the community pharmacy can't help you with that. In terms of obviously the management of those conditions, there's a lot of it that is about promoting self-care and sort of taking your own health into your own hands, which obviously Catherine was mentioning earlier, in terms of the making sure you drink plenty of fluids, making sure that you are looking after yourself, and also giving yourself time to recover, I think is a really important thing to do. And when remembering about being ill, sometimes things just take time and rest, and it's really important to remember that. Okay, so I'm that's sort of, obviously these slides are, you'll be able to pause if you want to have a look and read through the conditions that you can go to the pharmacy about if you want to go into more specifics. But obviously there are always options to speak to the community pharmacy first. So going on to the next slides, which are sort of more focused on what Catherine was mentioning earlier in terms of a bit of mental health, mental well-being support through the winter months. Is Catherine, are you taking this one, or is this somebody else taking this, or do you want me to go through it?
No, I think Nick was going to do this one if his lagging has resolved.
I'm not sure. I might still be laggy. So if you'd like to, Josh, you'd be very welcome to take us through this slide.
Cool. Okay. So obviously in terms of, there's a few different things. Unfortunately, we're going to have a social prescriber here to talk through this. It's one of our lovely team members, but unfortunately she's not been able to make it today. This is going to be her focus mentioning. But basically, the key things that she was going to mention is obviously there is a lot of support out there for things that aren't just healthcare. There's a lot of help for things like cost of living, which has obviously been a massive worry for everyone across the nation, no matter who you are, no matter where you come from. It has been a concern for everyone. And there's a lot of little sort of tips that we've sort of come up with that you can really use to sort of implement and try and keep those energy bills down a little bit, and hopefully save yourself a little bit of money while also keeping your health as good as possible by not getting too cold. And as you can see on the slide, you've got safely using a hot water bottle. I know that you should always use a hot water bottle with a cover on, because otherwise you might burn yourself if you happen to fall asleep with the rubber on you, and that happened to my mum actually, so definitely don't do that, it hurts. Making sure you're always turning off your electrics, obviously that's important all year round, but especially over the winter that can really save some money on radiators overnight and things like that. And the advice is with radiators, which I'm sure you've all heard before, is trying to keep your radiators on at a lower temperature, but over the full day, so that your house isn't sort of going up and down in temperature as much, but staying more consistent, is actually more energy efficient. And then the good old, as you can see with everyone here in the call, putting on plenty of layers. You can never put on too many. Get some big jumpers and get things on when you're getting a bit cold. Obviously, that's always useful. And that links back to the question earlier about cold hands and feet. Gloves are happily to be worn inside, and so are socks. So make sure you're wearing your slippers everywhere you go. Now, it does become obviously more difficult. And if you are needing a bit more support, there is also a lot of support in terms of getting a bit more support with food. And there's 3 sort of main ways that this happens in our country at the moment. And there is definitely information that you can find online about this, but there is one which is finding food vouchers, which allows for you can get in contact with a food bank to then potentially get you some support, and they can then obviously provide you with a voucher which gets you some food from a food bank, and that's sort of a referral agency that will manage that, and that you can obviously find online, or you can get in contact with the GP surgery for some support with that, or potentially just looking for your normal sort of citizens advice, and social workers and things like that can help with that. There are also food parcels, which are sort of sending out of food to people who potentially can't get out of the house. And that's also a very, very important service which supports people who potentially are stuck inside. And obviously, as Catherine was mentioning earlier, the elderly people who potentially need a bit more support, there are options for food to be delivered. And then finally, obviously, if you are able to get out visiting a food bank, there is obviously usually charities run by volunteers, that are, you can obviously see them in the supermarkets. And for those of us who are more fortunate, potentially donating to those boxes, and especially around this time of year, is really important. Just throwing in an extra can of soup or an extra can of beans that could really help somebody in a time of need is obviously really important to try and do. In terms of, there's a really good website that's linked here on here called warmspaces.org, and that can really help you find somewhere for a bit more support. Okay, and as you can see, it's obviously, there's a lot of support out there. It's just finding it is the most important thing. Here's some useful links that obviously if you want to come back to later and pause and go into them, then obviously you can find them. But there's obviously at the top there's some information about with babies and young children. There's a little bit about being active in the winter. Obviously it's easy to become a bit more sedentary in the winter, spend a little more time on the sofa under a blanket watching TV, especially around Christmas, but making sure that we keep ourselves active as much as we can is always good. And then obviously a couple of links about information about staying well in winter. So my next thought was that we would start taking questions, I think. Is that right?
Yes.
So we will go back to the beginning. I know it's been a while since we've answered any questions. So
thank you very much.
So we are
that was tremendous.
So going back to the beginning, the first question we had was from Malcolm Roberts. This was about quarter to 7 actually, so it was a little while ago. He was asking about home visits for a flu and COVID vaccine, and he called up his surgery to ask for them. And if you don't mind, I was just going to say, when we are doing home visits, we have got the capabilities of doing home visits here at the surgery. The difficulty is we do have a very limited service for that, and we have to limit it to people who are entirely housebound. And if they are able to get out of the house for anything, we do have to ask them to help us help them, if that makes sense. I don't know if anybody else has got anything to say on that.
I agree with you, Josh. Absolutely.
Lovely.
Absolutely. And I think it again depends on individual circumstances of the individual, and that is something you work with your practice to liaise with.
Definitely. The next question is from Tracy Ferguson. asking about brittle asthma. She has brittle asthma and diabetes. She's asking if she can get the pneumococcal vaccine. I'm not entirely sure on the rules of that, so can somebody else answer me on that one?
So pneumococcal vaccine. See,
Josh,
the babies.
I've been spotting up.
Sorry, Nick. Do you want to answer this?
Dilsha, if that's okay. So if for diabetes, if you take medication for your diabetes, including insulin, then you'd be entitled to the pneumococcal vaccine. Not many people with asthma would be eligible. Only if you're on continuous oral steroids or other quite high-level treatment would you be eligible. But everyone who has COPD, which is a different lung condition, many cardiac conditions, as well as anyone over 65, would be eligible. So I hope that helps, Tracy.
Lovely. So the next one, I've got a question from Angela Groves. I'm supposed to have a review for my asthma, but no one's rung me yet. I can answer for us here in AWC Modality. I know that there is a quite significant shortage of respiratory nurse review appointments available currently, and that's partially due to COVID. And I know that's a horrible excuse, and it's sort of getting to the point where we can't use it anymore. But it is ultimately true that unfortunately, because of COVID and obviously the backlog of respiratory reviews that need to be done, we are still trying to catch up on everyone. So just be patient with your surgery. If you have a more pressing concern with your respiratory condition, then obviously do get in contact and organise that more actively. But do trust that the surgery will get round to asking you some questions when they can and getting you to get booked in for that review. The next question was from Patricia Reville. I've just had my 70th birthday. Am I due a shingles vaccination?
Absolutely. Anybody turning 70 is eligible for a shingles vaccine. Actually, to make things a bit more complicated, from 1st of September 2023, the rules have changed. Anybody who's actually 65 and over, from that day onwards is now eligible. But unfortunately, those who have not turned 65 before the 1st of September still need to wait till they are 70. So in your case, Patricia, you're definitely eligible at the age of 70. That's your birthday gift. That should come through. So shingles is definitely available.
Lovely. Thank you, Dilsha. So the next question was from Elaine Johnson saying, I take a biologic medication and not sure which vaccines are safe. Unfortunately, Elaine, it is one of those situations where you'll probably have to speak to your GP because it depends on your biological medication, which vaccine you're allowed to have. And obviously it'll be very, very patient case specific, depending on which vaccines would be the most suitable for you. So I'd recommend you speak to the GP surgery about which ones are most suitable for you. And even if it's different changes to the vaccines, normal vaccine regime, it would be absolutely fine. Next one.
Josh, usually there's a rule of thumb with the biologics. Any live vaccines are not recommended, but any inactivated vaccines are recommended. If anything, those who are on biologics need to make sure that they maintain their immunity with certain vaccines. For example, flu vaccine, influenza vaccine, even more imperative that they get it actually. And these are inactivated. And the other one that Catherine mentioned, pneumococcal one, yes, absolutely. They're eligible for it. It's an inactivated vaccine. It's not a live vaccine. So by inactivated vaccine, I mean is a vaccine that does not have the live bug in it. And the inactivated vaccine is where inside the vaccine, there is there is no actual virus or active bug in it. It is the non-live form of it. So if that makes sense.
And yeah, exactly. And it's important, Elaine, that if you ever are going for a vaccination, that you mention to anybody who's giving you the vaccine that make sure they are aware that you're on a biologic.
Absolutely.
The next question from Kirsten Squires. I often feel like I've had a cold ongoing for many weeks. Is this all one bug or is it several different bugs? I would love to be able to tell you, Kirsten, but unfortunately, as Catherine was saying, with young children especially, it's really easy for it to be one virus into the next. Our immune systems are a very complicated thing that unfortunately we can't necessarily keep up with what they're fighting at any one time. And all sorts of things can affect that as well. In the sense that if you're having a particular stressful time at work, your immune system tends to not work as well. if you're having a particular stressful time, whether you are fighting another infection, a lot of things can contribute. So I'm sorry that you've been feeling ill for the last few weeks, but keep on fighting. And as we said, make sure you're drinking plenty of water and give yourself that time to rest and keep yourself warm. Okay. Next question.
Catherine, what do you think of that? You are our self-help, cold and tough guru.
Yeah, I was there nodding away because I couldn't agree more, Josh. Thank you. We can't underappreciate how much our mental health and stresses can affect our experience of physical health. So yes, thank you for raising that important point.
Yes, and as Nick mentioned earlier at the beginning of this call, it's hard to keep spirits up during the winter months because it is naturally in the UK not very nice weather outside, and it's cold and it's dark and it's miserable. But it's important to look at the positive things, and that although it's mind over matter when it comes to illness, it is a case of sometimes that does actually work. If you have the right outlook, you do get better quicker sometimes. So the next question from Selena Barlow. I have arthritis in most joints and I can get worse pain over the winter months. How can I help this? There we go. There's Selena Barlow's question. So obviously it's quite common for chronic conditions to flare up over the winter months, particularly arthritis, respiratory conditions, and things like that. So it is important to obviously try and keep ourselves warm and keep ourselves regular. And as we were talking earlier, make sure we're stocked up on our sort of as when required pain support in terms of whether you're using a topical ibuprofen gel or whether you're using oral tablets. It's important to make sure you have enough. And I was going to sort of link back to actually what Catherine said earlier in terms of around Christmas time. Make sure you know when things are open and make sure you leave enough time to make sure you get in contact with, if it's your doctor's surgery, if it's your community pharmacy, make sure you give them enough time to be able to help you before they close, especially around that sort of those bank holidays. Those can really catch people out for sure. So make sure that. So the next question is not really a question, but more of a statement. Ben at Sharrow, I'm a GP from elsewhere. What a brilliant broadcast. Thank you. Well, thank you, Ben, for tuning in. It's nice to see other people. Other people appreciating
Can I
this.
just mention about Selena mentioning about her arthritis and joint pain?
Course.
I think this is so common as we get older. I think many people struggle with joint pain through the winter months, more so than in the summer. And I think Josh, your recommendations were spot on there. But also, depending on what joint is affected, things like wheat packs, warm wheat packs, and going back to that hot water bottles, warmth can really help with joint pain as well. So it's maybe worthwhile just a little think yourself about what self-remedies may help with the joint that you have got problems with. For example, things like knee pain in the winter months and layering up a bit. Tubi Grip that you can buy over the counter is a very light support bandage, but just provides another layer for if you're outdoors in the winter months. That might just mean that the cold creeps in that little bit less into that joint. So maybe just have a little think. Each person and each joint is going to be specific there to a recommendation. But yeah, I hope you can think of something with what we've said there.
Yeah. So the next question is from Malcolm Roberts again. Why can't I ring my surgery for my meds review? I rang and got my COPD review, and I got told to ring again for my meds, but I was another number to ring. So can you tell me why they couldn't do it all together? Ultimately, the complexity around this, Malcolm, is obviously without knowing exactly what medicines you're on. The way our processes work here at AWC Modality, if you are from our area, and I can't speak for other areas, is that certain conditions can be reviewed by more specialist people. So we have respiratory nurses who'll be able to do your COPD review, but they potentially wouldn't be able to review if you're on other medications. So whether those are medications for your mental health or medications for your stomach or anything else, it might be that the nurses can't cover that in their review, possibly because they don't have the time in order to make sure they have enough. They do a decent enough medication review in terms of managing your respiratory condition and making sure that that's covered fully. So that's possibly why you've been requested to have another review separately to that. Obviously, without knowing specifics, I wouldn't be able to go into much more detail than that. Another very interesting question from Angela Groves. What happened to masks? Is the question here. I don't know if somebody else wants to take that.
So the guidance of maths is now, the mandatory requirement is now off leftness now. We don't need to worry about it. But what is very clear is that actually, if you think you are in a setting where you are immunocompromised, you feel you are at risk, yes, you can wear mask, and you can ask the healthcare individuals who are looking after you to wear masks, and that is on an individual case by case basis on patients who could be at risk. But overall, the mandatory requirement for a mask in social settings is now not that's been waived off. Having said that, it is important, like Catherine was mentioning about, along with mask comes the concept about sanitizers. So yes, actually in the winter months, more so if you can maintain those principles of infection control, the chances of you passing or getting infections will reduce if you follow those simple principles. And I think nobody more could explain that than Catherine. She was so articulate. Actually, Catherine, I learned too. I just need to put you on loop.
Yeah, I think.
What to do.
Yeah.
Having just said that about masks, if you are attending one of our GP practices, if we have asked you to come down for a face-to-face assessment, we would be really pleased if you were to wear a mask. Not only for the clinicians seeing you, who are obviously coming face-to-face with many different viral illnesses throughout their shift, but also other patients that are in the waiting room who may well be vulnerable. So if you don't mind wearing a mask and you are coming with us to us poorly with a respiratory illness, please do consider wearing one. That would be very helpful to us. Thank you.
Absolutely. And this goes back to the same principles of, if you got infection, to try and limit it, isn't it, to anybody else?
I think that's the most important thing is masks, as you said, are no longer mandatory, but they are still just as effective as they were during COVID at reducing the risk of you catching or you passing on the diseases. It's just that we don't have the same sort of pressures around COVID as we did previously. But obviously there's still flus, there's still, as Catherine said, lots of nasty viruses going around to try and get those sore throats for you. So I hope that answers your question as well, Marina, Debbie, as well. There have been also some people.
Thank you very much, everyone. I'm conscious that we do need to finish up very soon, Josh. I'm sorry, I'm slightly jumping in, but I did want to acknowledge Brenda, who's made an important comment in the chat, describing a very difficult experience, and her husband's unfortunately died very recently. So we wanted to extend our deepest sympathies to you, Brenda. And it seems like you were upset with the care when you reached out to your GP surgery. Obviously, we don't know the specifics. I'd really encourage you, please do speak to your GP surgery about that. I'm sure they'd want to understand what had happened and talk to you about that. But again, our deepest sympathies with you, Brenda. And also, I wanted to flag up, Jasvinder has also flagged up that she's got a huge gas bill and electricity bill when her family have a very limited income, and that's something that Josh alluded to in earlier. We recognise that many people are really struggling with the cost of living rises and how that impacts on people's ability to heat their homes. We've been talking about keeping warm in the winter, and there's lots of help out there, Jasvinder, and your social prescriber at your GP practice might be a good person to speak to point you in the right direction for what help might be available. Is there anyone else who wants to kind of close up, given them we're almost out of time?
Yeah, obviously there are a few more questions in the thing, but I think we are running out of time. We are going to have to get going. There are a few questions in here just regarding obviously very specific concerns that you're having with your pain. And as we were going through the slides earlier, obviously the recommendation is to go to your community pharmacy, speak to them about it, and if they feel like it's needed, they will obviously refer you on to who you need the support from. And that goes to both Kojo, Pra, and also Marcus Dupree. speaking to the surgery or going straight on paying passed on to the pharmacy, of being passed on to the surgery, be a good thing. So I think that's all the time we have. So I just want to say thank you to everyone who's turned up tonight. It's been lovely to have a chat with everyone. I want to say thank you to our speakers, Dr. Nick Bird, Dr. Dilsha Singh, and Dr. Catherine Howe, as well as the 2 people working behind the scenes trying to answer your questions in the chat. I hope that people have found it helpful. And obviously, thank you for tuning in. And anybody who watches after the time, thank you for watching the video, whether it's on YouTube or on our Facebook. I hope you do enjoy it, and we haven't bored you too much. And I hope that you found something useful in the tips. All right, thank you very much. Bye bye.
Thank you, everybody.
Thank you, everyone. Bye. Keep safe. Keep warm in winter.
Bye bye. Take care, everybody.